Dear students, hello, good morning, good evening to you all. How are you today? Hopefully you are in good condition, in healthy condition, and you are ready to learn English for medical purpose. As our tradition, we have our tradition for you to give your capability in presenting English language, by making video. We go back to that since I still need you, each of you, give a presentation in English. Okay, so our topic now is about information about alternative treatments. It's regarding the case study 19. It's about breast cancer. The main question will be, should the doctor give the proper informed consent to the patients? Okay, let's start our case study. Case study 19, information about alternative treatments. On January 28 January 1991, Mrs. X, a 53-year-old woman, was examined by a doctor who then ordered a surgical biopsy. And then, 1 month after that, on 14 February 1991, the results of the biopsy showed she was suffering from breast cancer. At the time, 2 treatment methods were available for treating Mrs. X's disease. The first method, mastectomy, entails surgically removing all the breast tissue, while preserving the underlying pectoral muscle. The second method, known as the conservative treatment or breast conserving surgery, involved removing only the tumor and a small amount of surrounding tissue. So the first one is removing all the breast. The second one just removing the tumor only and several tissue from the breast. The doctor advised Mrs. X that while the conservative treatment for breast cancer was being implemented, this method was not yet fully and accurately understood. The doctor also told Mrs. X that her breast would be totally removed, but the pectoral muscle would remain. So the doctor chose to have alternative method, not the conservative one. At the time of the operation, the conservative treatment for breast cancer was not yet prevalent, 1991, and mastectomy was the primary method used. There were not too many reported cases of implementing the conservative method. Results had only been observed for a short period of time, and the method of treatment had yet to be established. Nevertheless, at the time of Mrs. X's operation, the doctor was aware that a sizable number of medical institutions were using the conservative treatment for breast cancer. The doctor operated Mrs. X on February 28, 1991, 1 month after the diagnosis, and removed her breast. Before the operation took place, Mrs. X handed the doctor a letter outlining the complex sentiments of a woman diagnosed with breast cancer and faced with a choice between continuing to live and having her breast removed. So the main question about this case study 19, is like this. Was the doctor under an obligation to inform his patient about the conservative treatment for breast cancer, which at the time had not yet been strongly established? Yes or no? If you said yes, for example, this is the reason. Yes, the doctor should have told Mrs. X that alternative treatments were available. The breast is located prominently on the front of the body and is a symbol of femininity. For a woman, not just femininity, it's a dignity. So breast is my dignity, my identity. So if you said yes, for example, you said yes, one of the reason will be, this is my dignity, this is my identity. Why don't you tell me the other choice? Yeah, the other choice instead of this treatment. Or no, for example, you said no. The doctor did inform Mrs. X that there was a way of preserving the breast. He did refer, more or less, to the alternative treatment method and mentioned its pros and cons and the prognosis after treatment. Yeah, sometimes the doctor, they don't want to take a risk. Yeah. They probably in this understanding of the answer saying no, that the doctor don't want to take high risk to the patient with the treatment that's still in pros and cons, and that's why no, the doctor should take the safe way to save the patient. So yeah, this is the case study 19. It's about information about alternative treatments. So there will be a conservative treatment and the alternative treatments. Sometimes the doctor took the conservative one since he plays safe to treat the patients, even though for the alternative treatments in this case study 19, is about giving the dignity to the woman. If you have breast cancer, you still have right to have the breast. Just remove the cancer, please. Just remove the tumor, please. Yeah, that's the idea. So what do you think about this? Doctor tried to do the job, but should the doctor do the job better or not? In your opinion, I'll be waiting for your answer in video reaction. Thank you. Good luck for you all.